presentation for the Alzheimer's Association Greater Indiana chapter. This time we're going to go a little bit more in depth about areas that you can help volunteer, whether that's programs, services, fundraising events, advocacy. There's a little bit of something for everybody. So first I'm going to talk a little bit more about our helpline. We do have a 24/7 helpline that is answered here locally. When I say locally, I'm in Indianapolis, at our Indianapolis office that's on the north side of Indy. And when someone answers the helpline, they help either coach that person that's on the other line, possibly just hand out information and referrals, maybe register them for an education program or a conference. There's different types of responses, and we do have some training involved or answering the helpline in the best way and how to handle any situation that may occur. And we are looking for helpline specialists to help us answer the phone. We're also looking for people to help us with data entry. There's lots of online information you do have to input from time to time and could use some additional hands. Both opportunities do require a little bit of training just so that you feel comfortable handling any difficult questions that may come your way, and understanding confidentiality and conflict of interest and all of that. We do ask for a 1-year commitment for becoming a helpline specialist. Again, there's some in-depth training. We do prefer if you have a social work license, that is ideal. And we also recommend that you are not a current caregiver. If you've unfortunately lost a loved one, we do think that it's best if you've had some time to process the mourning period and to be able to have a positive demeanor when you answer the phone. So if you have questions about whether or not you would be eligible for this position, we'd love to talk with you further about it. But we do have some exciting opportunities in this area, and it's wonderful to be able to help caregivers and those that are really concerned about memory loss and wanting to provide care for their loved ones. So this is a great opportunity to really directly support our community. And support groups is another area that's very hands-on and direct care. Support groups are led by volunteers. At the moment, we do not have any support groups that are led by our staff, which is great. We'd love to keep it that way. We also are co-facilitate support groups. So perhaps you don't feel comfortable leading the group by yourself, or maybe you know a friend or a family member that would be interested in this area as well. Perhaps you could both co-facilitate a support group. Support groups are great because they are a way that peers can connect together, talk about ups and downs of caregiving, provide a network of support for those that are going through some really difficult situations. So support groups are a wonderful service that we're able to provide. We'd love to talk with you about helping either lead one or helping co-facilitate an existing one. Again, we do have quite a bit of training with that as well so that you are best prepared to lead conversations, perhaps even redirect a conversation if it goes awry. Just be prepared to do and to be able to handle anything that might come up in a support group. And again, we do ask for a 1-year commitment with this opportunity. If you have a background in social work, again, this is a wonderful way that you can use that to help serve the community, but that is not a requirement. It's just a wonderful environment for caregivers to come together on a monthly basis or however best works for their schedule and really be able to network with people that are in a like-minded community. If you're interested in support groups at all, we'd love to talk with you further about some possible training. Education programs and community engagement. This is another area that's a critical need. We know that we need to better educate and raise awareness about Alzheimer's disease in our communities. And what better way to do that than present a program and in a neutral location, like a community center or a town hall or a library. There's all kinds of different places that we have historically held programs on anything from the basics of Alzheimer's disease, the warning signs of Alzheimer's disease, to more really in-depth comprehensive programs. So we'd love to talk with you further if you're interested in helping spread awareness, if you are comfortable with public speaking, if you like teaching, if you like to really just be with a small or large group of people. The different programs can vary in size, and so we'd love to talk further about that. Again, there is some pretty in-depth training involved with this, so you're not sent off unprepared. You will have opportunities to know our programs and services side of things, know kind of the talking points and so forth. There will be PowerPoint presentations and things like that that you'll be given as tools. A community representative is another area that we'd love to recruit some volunteers to help us engage with our community. So if you may not be interested so much in the education program delivery side of things, but are comfortable representing Alzheimer's Association at a health fair or an exhibition, or even just talking with a closed group. So perhaps there's a lunch and learn opportunity with a company, or maybe there's a Kiwanis group or another community group that would like to have a 10 to 15-minute presentation on the basics of Alzheimer's disease. There's different opportunities within the community representative volunteer opportunity as well. Early stage social engagement. We do prefer that you do have experience with people with dementia. And this is, you can act as an agent of the Alzheimer's Association and chaperone our social outings for those in the early stages. We do have opportunities to visit museums and symphonies and provide a fun opportunity for those that are in the early stages of the disease. And we do ask our volunteers to accompany the early stage group and be more of a chaperone. There is some training involved there too. So if there would be an issue with someone feeling uncomfortable in a group, or if there's distractions, how to redirect, that type of training is involved. That's a fun opportunity, but it also is a great way to get people connected early on in the disease process. And faith ambassadors, we're looking for people that have connections and can help introduce representatives to the Alzheimer's Association through faith-based communities. And we'd love to talk with you about some opportunities that we have specifically for different audiences. And if this is an area that sounds appealing to you, we'd love to talk with you further about that. Clinical engagement is a relatively new volunteer opportunity with the Alzheimer's Association. And this is a way that we can create awareness around our healthcare providers, our physicians, clinical providers, and really let them know about the Alzheimer's Association, some of our services that we provide, and can help be part of the treatment plan for their patients. And we're really looking for some people that can help us market our services to different office buildings and physicians and can make connections on our behalf. We do see this as a way to help diagnose Alzheimer's disease as early as possible in the disease process and connect those families to support to make sure that they're adequately prepared for the long road ahead. So if this is something that you might be interested in, if you're familiar with sales and marketing too, if that's something that you feel comfortable doing, we'd love to talk with you further about our opportunities. And advancing public policy, we have seen some significant in the last handful of years on Capitol Hill, and it's as a result of our public policy efforts. We have relied strongly on advocates around the country to help sign different petitions and letters to try to make Alzheimer's disease a national priority. And because of those successes, we have developed volunteer opportunities to even further our success. And some of the ways are, there's some really in-depth ways to be a part of advocacy and public policy. An ambassador is a one-year commitment, and they're really a vital part of our program here, our advocacy program at the Alzheimer's Association, as a lead contact between the association and an assigned member of Congress. And they can play a leadership role between chapter advocacy activities and the community, and really step up as a leader. You would be working directly with our Director of Public Policy and Advocacy, be a part of our monthly phone call meetings to really know what our next asks are. Perhaps there's a new act that's in play that we're really trying to get support for. This is really an in-depth opportunity as an advocacy ambassador. It is a one-year term, as I mentioned, and if those positions are all filled at the moment, a great way to get started is to be an Alzheimer's congressional team member, which is another relatively new volunteer opportunity within the Greater Indiana chapter. And as a team member, you would support and assist the ambassador, helping to transform problems into solutions. And that basically means that you would help make phone calls or visits to distribute materials and information on their behalf, and really be a supportive team to rally behind that ambassador. The more voices we have to speak loudly about Alzheimer's disease needs and research needs, the better chance we can have at gaining additional federal support. That is also a one-year commitment that we do ask. We'd love to talk with you further if this is something that you might be interested in. These are a little bit of our successes that we've seen on the public policy side. Specifically, we have been very successful in statewide. We have an Indiana plan for Alzheimer's disease that was created adopted in 2000. And Indiana has been a leader in this area, and many other states have followed suit as a result. So we have seen some huge strides statewide as far as first responder training, dementia and safety training, and really letting our community know the differences between other health-related causes and how dementia makes everything just a little bit different. So this is a great example of what ambassadors and congressional team members can do. So our Walk to End Alzheimer's, hopefully you have heard of it, is our largest fundraiser. It is a nationwide fundraiser, and In Indiana, we have 12 walks around the state, and we've seen significant growth over the last decade, specifically within the last, and that is because we have really rallied behind our volunteers, formed committees, encouraged community support, and it's really made a difference. So if you might be interested in helping us raise $1.5 or more statewide, we'd love to talk with you about being a part of a planning committee. Just a few of the opportunities surrounding each walks committee. You could be part of the sponsorship committee to help recruit new sponsors and strengthen relationships with existing sponsors. Maybe identify new business communities that we might be able to partner with down the road. Team recruitment is also a committee. You can help us find new walk teams, engage with new families, be a part of the new team kickoff events, and really help us make sure that we're reaching all corners of the community. There might be some phone call opportunities to team captains, recruitment efforts, and so forth. There's several different ways that we can be creative in getting new teams to the Walk to Alzheimer's. Also, there's a team retention committee. So those that have been a part of the Walk to End Alzheimer's over the years, we want them to come back, and we want them to invite their friends and their family members and make a bigger impact. So you can help us work throughout the year to retain our past team members and strengthen those relationships even further. We do have a walk celebration party and so forth that you could be a part of as well with that. Marketing and outreach committee. So if you like creating awareness, if you're good at marketing and promotion, we'd love to talk with you about this. Make sure that our collateral distribution takes place across the community, build public awareness of not just the walk, but the Alzheimer's Association. We'd love to talk with you further about those opportunities. The mission committee, we want to make sure that we stay focused and know exactly why we're holding the Walk to End Alzheimer's. So the mission committee is responsible for and public policy activities at the Walk to End Alzheimer's, including the Promise Garden, which is a wonderful, heartfelt, emotional portion of our ceremony. It helps connect the community, our teams, and our team members to our mission, and really helps identify opportunities to engage walk participants in advocacy efforts. So that's another great area of need. And lastly, we need people to be a part of our logistics committee. So if you like the day of event logistics, we'd love to talk with you about those opportunities, help us recruit and train day of event volunteers, and ensure walk day components like the start and finish line, the opening ceremony, and the walk route are all very well planned. So those are just a handful of things that you can do within a committee structure at the Walk to End Alzheimer's. And if you'd rather just be a part of the event day of, we are looking for people to help us set up, tear down, that sort of thing. We could love to talk with you about just event day opportunities. We have a lot of other events too. Not all of these are statewide events. So I want to talk about what these look like, and if you're interested, we can talk further about what the event structure looks like. The longest day is our second signature event. So the Walk to End Alzheimer's is our largest event. The longest day is the next largest, and it's an opportunity for teams around the world to honor caregivers and those facing Alzheimer's every day with a day of activity. So it's held on the summer solstice in June, and it calls on participants to raise funds and awareness of the Alzheimer's Association, and some opportunities that we've seen teams do are bake sales, maybe an urban scavenger hunt, barbecues, We've had some other people hold their own community walks and runs, 5Ks. It's an opportunity where we can be very flexible about what the fundraiser is, and you can incorporate people from all different states. It does not have to be a set location. People sometimes use the day to honor an activity or do an activity that a loved one likes to do or enjoyed doing while they were living. So if somebody would like to hold an event in honor of their grandfather who loved to fish, you could have a fishing day. So those are some examples. We really need to help spread the word about this event, and we're looking for people to join our team task force and spread awareness and really help plan logistics surrounding this event, because it is kind of a mouthful and it's a little hard to describe. So we need to really find better messaging and raise awareness about it. Chocolate Sunday is our upscale annual fundraising event. It's held in November every year. It is an Indianapolis, surrounding Indianapolis area event. It consists of champagne and chocolate. It's a brunch with a live auction, and we are looking for committee members to help us play an important role in recruitment of sponsors, table hosts, and acquiring auction items for that. The Memory Cup is a golf outing held in the summer. It's also a surrounding Indianapolis event. We have a committee for that to help plan logistics and recruit sponsors and participants, and also a silent auction as well. Blondes versus brunettes. We are really looking for players to help participate in this event, coaches and fans. It's a powder puff football game held in the summer, and it creates two teams of 30. Usually they are young professional women, and based on hair color, they can be on one team or another. And they can, reflect the age-old rivalry between blondes and brunettes and really encourage philanthropy, fun, and friendly competition while they're fundraising. So this is usually it's held around Indianapolis, but we're looking for people to help participate in this event. And All-Stars is an opportunity, not necessarily on a committee structure, but if you're already participating in a athletic event of some sort, so if it's a 5K or a triathlon, you can participate as an All-Star. We will help fund your or pay for your registration and give you a jersey so that you have the logo prominently displayed while you're running and participating. We do ask that you fundraise for the Alzheimer's Association, and we can be of support to you in that regard. So wanted to let you know about that and would love to talk with you further about it. So shifting gears a little bit, we do recognize our volunteers as representatives of the Alzheimer's Association. So because of that, I have put together these guidelines and I'm just going to point out a few of these things to let you know what we as staff members and would like to extend it to our volunteers. So a few things. We do say the Alzheimer's Association. That is the name of our organization. I have heard some people say other words and terms, but did want to point out that we are the Alzheimer's Association. We also recommend saying caregiver or care partner. This is just a preference on our part, but I know that some folks do say caretaker in regard to that same position. That is just not a term that we prefer. It's not something that we're going to, get upset about or anything, but just be mindful of it as you are out representing the community or representing the Alzheimer's Association in the community. A few other terms that we say are younger onset Alzheimer's disease rather than early onset Alzheimer's disease. And, one of the other things I wanted to point out too is that we do have a 24/7 helpline, and I have heard it called the hotline. This is just a branding consistency thing. We do prefer to use the term helpline. I'm not going to go through every single item here. I will pause for a few moments so you have a chance to read through these guidelines and recommendations. And if you have any questions about anything in particular, please feel free to reach out to us, and we can be happy to talk through some of these guidelines and what they mean. Thank you again so much for taking the time to watch this video and showing your interest in being a part of the Alzheimer's Association Greater Indiana chapter. At this point, if you have not yet filled out an online application, we'd love for you, highly encourage you to do that to get started. You will then be contacted by someone here at the Alzheimer's Association, and we'll introduce you to the appropriate staff members according to your areas of interest. If you have any questions at all, feel free to reach out to us. You can call us at 800-272-3900. You can reach out to us on Twitter or Facebook, or you can visit us at alz.org/Indiana/volunteer. Thank you again.